Good evening, everyone. How are you? Hope you're doing good. Today, I'm going to talk about one of the important topic that is monogenic forms of diabetes. Let's go into the topic. These are diabetes occurring due to defects in a single gene. That's why it is called as monogenic diabetes. Many of these conditions have been lumped together under the category of MODY, maturity onset diabetes of the young. This is the term which is coined by Tattersall and Fudgens, who also put forth the clinical criteria for the diagnosis. MODY is a monogenic disorder due to mutations in one of the several MODY genes. These mutations are transmitted in an autosomal dominant fashion, with 3 consecutive generations of the family being affected. Some of the important genes implicated in the MODY are: number 1 is MODY1, which includes HNF4 alpha, which is hepatocyte nuclear factor. Next is MODY2, glucokinase; MODY3, HNF1 alpha; MODY4, insulin promoter factor IPF1; MODY5, HNF1 beta; MODY6, NeuroD1; MODY12, ABCC8. Let's talk about MODY2. MODY2 is due to mutation in glucokinase gene. Glucokinase is the glucose sensor of the beta cell, which is crucial for the insulin secretion. Inactivating mutations of the glucokinase gene, it will render the beta cell incapable of responding to the levels of the blood glucose, which would otherwise have stimulated the insulin secretion. The clinical phenotype is manifested as isolated high fasting blood glucose. It is termed as MODY2. It is a mild condition, it is asymptomatic and does not progress, neither it is related to diabetes complications. So we don't need to worry about it. As such, patients do not usually report to the doctor and they are incidentally picked up during the screening only. MODY2 is estimated to be the commonest form of MODY in the Western populations, but its exact prevalence is very difficult to assess for the reasons mentioned above, and MODY2 generally requires no treatment. The other forms of the MODY are collectively called as transcription factor MODY. These are due to mutations in the genes essential for the normal pancreatic development. These forms of the MODY are very severe and are associated with the diabetes complications. Very good example is MODY1 and MODY3. They are clinically important because the patients with these mutations, they respond well to the small doses of the sulfonylurea class of oral antidiabetic agents, at least in the initial stages of the natural history. And MODY5 is a complicated condition. It is characterized by a peculiar phenotype consisting of renal hypoplasia, renal cyst, and renal dysfunction. It is called as the renal cyst and diabetes syndrome, RCAD syndrome, which usually requires treatment with the insulin for the control of diabetes. So what is the clinical diagnostic criteria of the MODY? Let's see. The patient should be early age, at onset less than 25 years of age. It is non-insulin dependent diabetes, which should be controllable without insulin for at least 5 years. Autosomal dominant inheritance with 3 generations affected, that is vertical transmission, and absence of ketosis at any time. So these are the 4 points for the clinical diagnosis of MODY. The clinical criteria are not very accurate and they have been superseded by the genetic testing. Unfortunately, this genetic testing is neither widely available and not affordable. It is very expensive. In addition to the MODY subtypes, monogenic diabetes also includes neonatal diabetes that I will talk about later. As well as it also includes diabetes associated with the various syndromes like Walcott-Rallison syndrome, DID-MOAD syndrome, and Roger syndrome. Thank you so much for your kind attention, and my reference is Dr. Mohan's Handbook of Diabetes Mellitus latest edition, that is 7th edition. Thank you so much for your kind attention and kindly share my lecture to your friends.